washing my hands. Hi, my name is Hasana. I'm the student nurse for today. I'm here to do a head-to-toe assessment. Is that okay with you? We would promote for privacy, but for the purpose of this exam, we are going to leave the patient uncovered for the duration of the video. I am going to begin by asking the patient for their name and date of birth, confirming against the patient ID band. I would assess the patient's level of cognition by asking, do you know where you are? Do you know what month it is? And why are you here? I would then move on to assessing the patient's eyes using Perla. Here we're going to ensure that pupils are equally round and reactive and accommodating to light. So 1, 2, 1, 1, 2, and then fix on my pen without moving the head. Okay, I'm going to move on to the patient's mouth, ensuring that the mucosal membranes are appropriate for the skin tone, ensuring everything's intact and moist. Teeth are all intact, free of any decay. Lips are dry and moist, free of any dryness or cracking. No signs of any cyanosis, and ensuring that the uvula is mid-center. I'm moving on to the ears, ensuring that ears are bilaterally free from drainage, palpating the tragus for pain. I would then ask the patient if they have any trouble with headaches, vision, hearing, swallowing, I would then move on to the patient's chest. Expose the chest. We are going to auscultate for heart sounds, starting with the aortic, following the second intercostal space, aortic, staying close to the mid-sternum, and still in the second intercostal space of the pulmonic, going down for Erb's point, going down for tricuspid, going laterally. Here we're going to follow the midclavicular line into the fifth intercostal space. Here we'll find the mitral, and it is also the point of maximum impulse. We are then going to move on to auscultating the lungs. Here we're going to point out 12 different spots for lung sounds. We are going to start right above the midclavicular line, or subclavicular line. Here we're going to go at a ladder pattern. So we're going 1, 1, 2, 2, 3, 3, 4, 4. We're going 5, 5. Moving down to 6, 6. And here we're going to ask the patient if they have any trouble with shortness of breath, any problems with coughing, and any pain. We are also going to auscultate these lung sounds posteriorly. Moving down to the abdomen, we are going to auscultate the abdomen, going at a clock pattern, starting at the right lower quadrant. Here, right lower quadrant, right upper, left lower. We are going to move on to palpating the abdomen, following the same pattern clockwise, going right lower, right upper, left lower quadrant. Here I'm going to ask the patient if they have any nausea, vomiting, diarrhea, constipation, any changes in bowel habits, any changes in the urinary patterns, frequency and consistency. I'm going to move down to the genitalia area, making sure that the patient is free from any discharge, lesions, or skin breakdown. We're doing that posteriorly too. Moving down or back up to the top, we are going to pinch the clavicle for skin turgor, and then we are going to assess bilaterally for symmetry and temperature, making sure that the skin is free of abrasions, lesions, or scarring. Here we're going to palpate or assess radial pulses bilaterally or simultaneously for rate, rhythm, and force at a 3+ scale. We are going to ensure for a capillary refill of less than 2 seconds on all 10 fingers, holding at least for 5 seconds. And then we are going to move down to the lower extremities to do the same. Here we're going to assess the patient for symmetry, temperature, ask the patient if they have any tingling, any numbness, any pain. So we are gonna assess for any edema on both legs, starting from the bottom to top. Here we are now going to move down to the pedal pulses, assessing for rate, rhythm, and force at a 3+ scale. Moving to the anterior tibial, same rate, rhythm, and force on a 3+ scale. We're going to check for capillary refill on all 10 toes, pressing at least for 5 seconds. Capillary refill of less than 2 seconds each. And we are also checking this posteriorly. Now we are moving to the patient's muscle strength and range of motion. Here I'll ask the patient to squeeze my fingers as hard as they can, pushing and pulling against me for muscle strength. I will assess the patient's range of motion, and the patient will follow my commands of supination, pronation, flexion, extension, abduction, adduction, and circumduction. I have already obtained a set of vitals on this patient, and everything falls within normal range. I have completed my physical exam. I'm gonna lower the bed to a safe position. Is there anything else I can get for you? No? Okay. So the call light within reach. I'm gonna cover the patient back up, and that will complete my head to toe. And wash my hands.